Patient assessment trauma. You have 10 minutes to complete.
Okay.
Do you have any questions?
I do not.
All right, you are dispatched to Smelterville
Okay.
for a gunshot wound staged prior to arrival.
Okay. Any additional information?
Yeah, you're en route. Cops have secured the shooter has left.
Okay. Besides my scene safe.
Yes.
Okay. Any additional information for my patient?
And the cop's like, dude, he got shot over there.
Okay. Is this my only patient?
Yes.
All right. I'm going to call additional resources if needed, and I'm also going to always have C-spine precautions in my mind.
Okay. So you walk up on the patient. He's laying on the sidewalk. A moderate pool of blood is under his left leg.
Okay.
And cops are holding their gloved hand over his chest that you notice.
Over his chest? Okay. So my general impression, just because of the things that you've told me, is poor.
Okay.
My mechanism of injury is gunshot wound for this patient. Is he responsive?
He is responsive. He's yelling in pain.
Okay. Is that my only life threat at this time?
That he's yelling in pain?
That
Or
no, that he's been shot.
Yeah, he's been shot.
Okay.
The cops say that he's been shot twice that they've seen.
Twice that they've seen. Okay. I'm going to control any immediate bleeding at this time as well. And then my chief complaint is my patient's been shot.
Okay.
I'm going to check his airway. Is his airway clear and patent?
Yes.
Okay. How about his breathing rate, rhythm, quality?
Rapid, regular, and good air movement.
Good air movement at this time. Okay. What about for my circulation?
Pulse is regular and rapid. Skin color is pale, cool, diaphoretic. He is bleeding out of his left leg.
Okay.
Large pool, moderate sized pool of blood under his left leg.
Okay. Control all the bleeding as I did before. I'm also going to take into consideration the oxygenation as well.
Okay.
I'm just going to have him on 15 liters per minute NRV right now. Also assist ventilations if needed.
Okay.
And I'm going to use airway adjuncts as well for that. I'm going to also have what's his GCS at this time? 15. I'm just due to the mechanism of injury and the injuries that this patient has sustained, I'm going to get him loaded in the ambulance, going to the hospital. I'm going to also have my partner start immediate vitals, 2 large bore IVs, either arm.
Okay.
I'm going to move into my secondary assessment for this patient as well, checking his head. Do I see anything on the posterior portion, top of his head, skull?
No, clear.
Okay. Checking his ears.
Clear.
Eyes. Pearl. Okay. Nose, any
Clear.
secretions, airway still clear?
Yes.
Check his cervical spine as well. Any step off, decap, BTLS?
Still clear.
Okay. Checking his neck as well, JVD, tracheal deviation, decap, BTLS.
You start to notice that he has JVD.
JVD, okay, noted. Checking his chest as well.
He's got a gunshot wound to the right upper quadrant of his chest.
Right upper quadrant, okay. I am going to put a chest seal on that, making sure that there's still one side that can be vented on it too. Checking the rest of his chest, any flail segments, decap, BTLS?
No.
Okay, for his abdomen, any decap, BTLS? No?
No.
Okay, I'm going to check his pelvis as well. Stable. Check his legs, decap, BTLS through his legs.
Right leg has a gunshot wound.
I'm going to control the bleeding for that as well. Is it bleeding profusely? Am I not able to stop it with bulky dressing?
No, you're not able to.
Not able to? I'm going to put a tourniquet on high and tight for this patient as well.
Bleeding's controlled.
Okay, I'm not going to have any sort of CMS in that leg at all. No pulses due to the tourniquet, but for the other leg, do I have CMS pulses?
Yes.
No decap, BTLS for that leg?
No.
I'm going to check his arms, distal pulses, CMS, decap, BTLS.
Arms are clear, pulses are present.
Okay. I'm also going to check the back side of my patient as well. Do I have any decap, BTLS?
Yeah, he has a gunshot wound on the right side of his back.
All right, so I'm able to see an exit wound. Is there an exit wound for that leg as well? Did it go clean through? No? Okay. Checking the rest of the back, making sure that's all safe as well. At this time too, just making sure what my vitals are. What do I get those back?
Blood pressure is 100/50. Pulse is 120. Regular respirations are 22.
Okay.
And he's got that gunshot through and through. To the back.
Has that chest-seal helped with any JVD or anything at all?
Yes, but has a gunshot wound to the right side of his back.
Yep, I'm going to also cover that as well.
Okay.
Making sure that it's completely dressed. When I listen to lung sounds, are those clear for my patient?
You have present lung sounds on the left and just diminished on the right.
Just diminished at this time? Okay. Noted. What is my pain level for my patient right now?
Now he's like an 8.
Like an 8? Okay. I'll make sure that I have fluid standing by, also making sure I take into consideration his respiratory drive as well. I'm going to give him 1 microgram per kilogram of fentanyl for pain.
Okay. Anything else you'd like to add?
Not at this time, just that I will reassess all my interventions, my vitals every 5 minutes, and rapid transport to the hospital.
Good job.